follicular unit extraction, follicular unit transplantation, direct hair implantation, body hair transplantation, robotic FUE, and so on. It sounds like the military alphabet, but don't worry, everything will be clear shortly. Let's start from the basics. There are actually two methods of hair transplantation, not 5 and not 10, two. Follicular unit extraction and follicular unit transplantation, also known as strip. They differ in the method of harvesting hair follicles. Implantation looks similar in both cases. Follicular unit extraction. It is the most commonly used method in the world. We extract individual hair follicles with a tool with a diameter of less than a millimeter, each graft separately. Advantages: no linear scar, only microscopic dots remain, which are not visible with short hair. Shorter recovery time, and the possibility of harvesting follicles not only from the head, but also, for example, from the chest or chin. Disadvantages: the procedure takes longer, especially when we are taking a large number of grafts. Follicular unit transplantation. This approach is different. We cut a strip of skin from the back of the head, we divide it into individual hair follicles, and implant the prepared grafts. Advantages: you can extract a lot of grafts in a relatively short time. Disadvantages: a linear scar that most often extends from ear to ear, plus longer healing and more pain after the procedure. That's why today the majority of patients choose FUE. Well, what about the rest of those acronyms? DHI, direct hair implantation. This method does not refer to how we extract hair follicles, but how we implant them. A special tool called an implanter is used, which simultaneously creates a hole in the skin and immediately leaves a follicle in it. It can be used both with FUE and strip. It is faster, more precise, and easier to achieve the correct angle and direction of hair growth. Robotic FUE. It's also the good old FUE, only the epidermal incisions are made by a robotic arm instead of the doctor's hand. And the grafts are still pulled out by hand, so it's still FUE, the same cookie wrapped in modern paper. BHT, body hair transplant. This is also FUE, as individual hair follicles are harvested. The difference is the harvesting location. Instead of taking from the head, it is taken from the body or beard. This method is used when there is no longer enough material to take from the head. Such hair is great for thickening, but not necessarily for creating the actual hairline. They may look unnatural because they have a different structure. This method works well in Arabic countries, India, and Asia. Usually the hair color on the body is similar to that on the head. In Europe, however, a beard can be red, while the hair on the head is blonde, so it's harder to match the exact shade. So when someone bombards you with acronyms and says they have the latest method, remember, there are two methods. The rest are tools, implantation techniques, and marketing. They stare methods dressed in nicer vocabulary to stand out from the crowd. Regardless of whether in Turkey, Poland, or the United States, the traditional FU method is most commonly performed. The name of the tool, and de facto the manufacturer, does not matter here in the slightest. I can right here and now name my method, for example, Ultra Super Micro FUE Kirach. But that doesn't change the fact that I use the technology and method like all my fellow doctors around the world, follicular unit extraction. Another lesson has passed. Thank you for not talking, and I invite you to the next one. If you want to learn more about hair and the procedure itself, I recommend my guides, The Secret Life of Hair and 101 Questions about Hair Transplant.